Today I wanted to talk about why you should think about including adjuncts into your debriefing. Hey there, my name is Phrampus. I'm the director of the simulation program at the University of Pittsburgh known as WISER. Today I wanted to talk about why to think about using adjuncts and including them into your debriefing. What do I mean by adjuncts? Well, they come in many forms or flavors. I'll give you some ideas here as we go along. But basically, when we think about debriefing, we think about a conversation. And we think about a conversation between faculty member or members and participants of simulation. Could be one-on-one, could be one-on-many, so on. But we generally are focused on the conversation and trying to elucidate what students were getting out of the simulation and help channel them into understanding what they did right, what they need to improve upon so that they can continue on their journey towards becoming excellent healthcare providers. At WISER, we tend to incorporate adjuncts into a lot of debriefings where possible. So what do I mean? What I mean is things that are brought into the debriefing environment that can continue to enhance the discussion, right? And we use them for different reasons and different purposes. And sometimes it's just to mix it up a little bit so that it's not just a dialogue between the faculty and the students. There are some other kinds of things to talk about. So some ideas of adjuncts could be a PowerPoint slide deck or a few slides that help to elucidate a complex or a topic that requires a deeper piece of understanding in the context of the debriefing. Another type of adjunct is the simulator log file. We use these a lot, and this will help to set the stage for the debriefing and sort of maybe create a pathway of discussion to chronologically follow out what happened during the simulation, what the simulator was experiencing, and those key things that went on during the simulation. Another adjunct could be a partial task trainer or a model that helps to describe something. For example, maybe the students forgot to do a jaw thrust or open the airway, and we can use a task trainer or a teaching aid incorporated into the discussion during the debriefing to help them understand the concepts. So one of my favorites is this airway opening mechanism that shows that the airway is closed when you create the head tilt chin lift. The airway is open. And sometimes it could be just as simple as that. Or perhaps if the patient is laying supine, show them that opening the jaw thrust or performing the jaw thrust can open the airway. This little demonstration that can go on during the debriefing can help cement together the ideas of what the primary learning objectives of the debriefing were supposed to be. Other things that we use are charts, graphs. When I debrief during my difficult airway management course for physicians, we have our algorithm up on the wall on posters, and we basically use the algorithm as a pathway to compare the performance of the participants of the simulation with what the ideal case would be. So there's many different ways that you can incorporate adjuncts into your debriefing to help with the learning process. Another good thing about using adjuncts is oftentimes when we are in a situation where we are debriefing a simulation, it's sort of our opinion as the faculty versus the opinion of the students or the participants of the simulation. You can use the adjunct or the learning aid as sort of a reference to standards. So basically you're taking yourself out of this back and forth conversation of you did the right thing, you did the wrong thing, and instead can use the adjunct as a third-party messenger of a reference to best practices, excellence, or the way things should have gone. So for instance, we could say, what was the next step in the simulation that you performed? And they could say, X, Y, Z. And then we can go to the adjunct and say, okay, now let's look at the guidelines provided by this society. Step 1 is this. Did you do that? Yes, we did. Step 2 is this. What did you do that? And go on and on and on until you get to a point where the simulation deviated from the standard of care. By using the adjunct on the wall, or in my case, I'm saying the algorithm that we use for difficult airway teaching, we can get the students to discover their own variations from the expected standard. I think that if you start to strategically think about how you can incorporate adjuncts into your debriefing, you will find the students are more satisfied with the debriefing. I think you will figure out that it increases the stickiness of the learning that goes on, as well as makes it a more enjoyable experience for the faculty member. So think about it. Add some adjuncts to your next debriefing. If you find our YouTube videos helpful, please smash the like button down below and consider subscribing so you don't miss any of our videos that'll come out in the future. Thanks, and as always, happy simulating.